Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the corset body lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Hello, Dr. Moya.
Hi, Brittany. Good morning.
How are you?
I am good. Thank you.
Good. So I want to talk about postsurgical drains. What is that exactly? How does it work? Tell me a little bit more about that.
Okay, great. That's a great topic. So postsurgical drains are little tubes. They can be round or flat that are placed within the operative area so that it can drain any potential fluid that might build up within the tissues. And the reason you need that is if fluid builds up within the tissues, it doesn't allow the tissues to seal together and heal.
Okay.
And then it can also lead, if you get a collection, could lead to a collection that could get infected. And that's the main reason surgeons use drains. We don't use drains to detect if there's any bleeding. That's not the reason we put drains in. We put drains in to collect the fluid so that the tissues can heal better.
Okay. So I know that you don't use drains. Tell us how you can get away with that.
Okay. And so at the end of the day, it's great if you have to use a drain for that reason, but it kind of stinks for the patient if you have to use a drain because now they have to manage these tubes coming out of their body after surgery. And it can be anywhere from 1 to 4, depending on the kind of body contouring procedure you're doing. It could be in anywhere from a week to a month. So, and I did use drains up to 2008, and I had the same issues, all this management of post-op drains, patients having to come back every so often, getting pulled out one at a time, whatnot. So I was looking for a better solution to this, especially with my bigger body contouring procedures, such as the corset body lift. I actually went from 2 drains to 4 with that procedure back in 2006. And so I found that one way, there's a few different reasons why we can get away without using drains. One of the biggest things is which I touched on the previous podcast, the use of harmonic ultrasonic instruments.
Right.
I found that if you use a technology when you're cutting tissue away that doesn't burn the tissue that's staying in the body has less damage to it.
Okay.
Meaning there's less inflammation, which means there's less weeping of the tissue. So you have less potential buildup of fluid.
Okay.
The other thing ultrasonic instruments can provide, depending on the type of device you're using, it can actually seal lymphatic channels.
Oh, okay.
So there is a ultrasonic device that's a shear, looks like a scissors. And that shear will seal everything in its jaw. So it actually will seal the lymphatic channels. And lymphatic channels are in the tissues where you're operating, depending on the different planes that you are operating in. And so if you can seal these, because they're microscopic, you don't really see them, they're so tiny. If you seal these, it's going to prevent another potential leakage of fluid. So harmonic has been a big reason why I've been able to get away from using a drain. The second reason is in the surgical technique itself, other than using advanced technology. I use a technique that's called tailor tacking.
Okay.
And this is in particular for my weight loss patients. What that means is I decide how much tissue to remove by pinching it together with some pickups. Then I kind of outline that tissue, and then I remove it where it lays. And then I just cut that right out. We end up with could be a pretty big size defect hole. And then what we do is we just pull the tissues that are surrounding that hole together. Very simply. Pull it together and close it. So with that technique, this tailor tacking technique, in the use with mobile skin, you don't have any undermining of tissue.
What does that mean?
Meaning you're not cutting underneath the tissue, the skin.
To release it. So you can pull it together. Okay.
That creates that space we talked about, that dead space, a potential space where fluid can build up. So instead we're pulling it together. And that only can work if you have mobile skin. So that's one of the things that we decide on if we're going to go to surgery in the office when we do an exam. So this tailor tacking technique has that significant benefit of not having a potential dead space. The other advantage to not lifting tissue to close it is that you don't create 2 surfaces that can now rub against each other after surgery when the patient's walking. We call it a shear effect. So when 2 surfaces rub together, they tend to create fluid, such as in a tummy tuck. And I'll explain that because now that's been lifted, you pull that down, you close everything. The moment you start walking, that skin that you lifted can move against the muscles.
Mm-hmm.
You don't really notice it because it's called micromotion. It's microscopic. It's very tiny motion. But that little bit of motion can produce fluid. So if you do tailor tacking, you don't have that potential space. You don't have this potential two surfaces that can create shear. Again, another reason why we don't need to use drains.
Well, do you always use the harmonic and not undermine with tummy tucks? Because you don't use drains with tummy tucks here.
Correct. So there are some procedures where you cannot use tailor tacking. Big one is going to be a standard tummy tuck.
Mm-hmm.
What does that mean? It's a single incision. To me, the single incision is a standard tummy tuck. Obviously, a standard tummy tuck can be extended, which would be known as the extended tummy tuck if it goes to the back, or it can go all the way around the body.
Mm-hmm.
And now you're talking a 360-degree tummy tuck.
Mm-hmm.
In the front, when you lift up the skin in a tummy tuck to get to the muscles or lift up the skin, you usually lift up to the rib cage so that you can pull the skin down,
Mm-hmm.
so that you can close the skin, the hole that you made when you remove the skin below the belly button.
Mm-hmm.
That has to be lifted. You can't tailor tack that down.
Right.
So once you lift all that skin, now you've eliminated tailor tacking. You have to do something else on top of the harmonic. I found that 1 in 10 tummy tucks, if I used harmonic alone, I would still have a little fluid that I have to drain.
Mm-hmm.
So there's another option. It's called quilting stitches.
Okay.
And what you do is you actually suture the lifted skin down to the abdominal muscles, underneath the skin, of course, down the abdominal muscles as you're closing everything. So now things are fixed. So when the patient walks, there is no movement of tissues. There is no shear effect.
No friction of the layers together.
Correct. And that's been around for a long time. I didn't develop that technique, but it allows us to also not use drains in procedures such as a tummy tuck where tissues have been lifted.
Okay.
I find that the harmonic just adds to that.
Okay.
There are surgeons who can get away with, in a tummy tuck, with that specific procedure, maybe utilizing less energy, not burning everything,
Okay.
that they can get away with using quilting stitches without drains, not having to use harmonic. Again, I do use the harmonic for those procedures. I think it makes it a little bit easier to get away without using drains, but of course it also leads to less pain anyway. So again, advantage for why we do that there.
Okay. How about a neck lift? I know you do a lot of harmonic neck lifts. So how does that work, and how do you get away without a drain there?
Great question there, because we're not going to put quilting stitches in. The issue with quilting stitches is you have to have some fat under the skin, because you will create a few dimples that will go away within 3 weeks usually. So a tummy tuck is perfect for that, because by that time either the suture pops or the tissue settle over the stitch and you don't see those little dimples on the outside. In a neck lift, the tissues are very thin. You try to put quilting stitches in there, you're going to create a dimple that might be there for a long time.
Right.
And that's in your face.
Right.
So we don't put quilting stitches there. The harmonic obviously adds significant benefit there, because that's the ultrasonic energy for lifting the tissues. That helps us with decreased drainage, but it also helps us in these patients in regards to the fact that they don't look like they had this big surgery, because a week later they may look like they would 3 to 4 weeks out with the electrosurgery. So one benefit there is the appearance. In order for us not to use drains in a facelift or neck lift where we're lifting tissue, we have to use appropriate compression.
Okay.
So I use foam. The foam tends to push the skin down nicely against the underlying tissue that was where we lifted the skin. It makes everything nice and smooth. So we do use that. I use foam within a sling for a week, 24/7. And then after that, we may use the sling at night only.
Okay.
We get rid of the foam. But that's how I get away without using drains in that. There are other surgeons that may use glue. There is a glue that you can use as well. I do not use that. So if patients were looking and investigating the use of no drains in a facelift, that's one other option. I don't use that because it adds an added expense, and I already have the harmonic. So I get away with harmonic and foam compression, no drains in a neck lift or facelift.
Okay, that's great information. I know there's a lot of patients that really get very anxious about drains and having to look at them, empty them, deal with them. They're just a nuisance. So that's really good information. And it's a good benefit for the patients that travel from out of town for these procedures that you do, because it's less that they have to worry about when they return home.
Correct. And it's less time for them to stay, around to have those drains removed. At the end, I think part of what we offer is not only when you have a surgical procedure done by a plastic surgeon, you expect to have the best result, right? Otherwise, why undergo the procedure? But why not also have the best recovery.
Mm-hmm.
So I think that's that fits in perfectly.
Awesome. Well, thank you very much. I appreciate it.
All right. Well, thank you, Brittany.
Mm-hmm. That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the course of body lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.